Welcome to Lessons in Framing Overdose Prevention, a national conversation. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague Jeff Bornstein. Today's web forum is sponsored by the National Overdose Prevention Network, a program of PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. Now let's meet the moderator of today's event, Dr. Mary Maddox Gonzalez. Dr. Gonzalez is a coach and preparedness consultant for the California Overdose Prevention Network, a program of the PHI Center for Health Leadership and Impact. She served as the Sonoma County Public Health Officer and Division Director and the Chief Medical Officer of the Redwood Community Health Coalition for Sonoma, Napa, Yolo, and Marin counties. She has been a board member and chair of the Latino Coalition for a Healthy California. Welcome, Mary.
Thank you so much, Merlene, and welcome to all of you to today's webinar on behalf of the National Overdose Prevention Network and Dialogue for Health. May I have the next slide, please? We're going to have a few poll questions. We're interested in knowing where you're from and a few other things. And as you know, this is going to be a really interesting webinar today, looking at how we frame overdose prevention and really looking at this from a national perspective. We will have an opportunity for question and answer at the end, so we invite you to put any questions that you have in the Q&A, and we will get to those at the end, as many as possible at the end of the presentation from our speakers. The next slide, please. Okay, so today, this will be really learning a lot today, looking at how to use layers of strategy to really shift the conversation about overdose prevention. You'll also be able to recognize the different starting points that exist when you're doing communication, opportunities, challenges, when you're advocating for the solutions that you are trying to accomplish. Then you'll have a better understanding at the end of this presentation of some of the very unique challenges when you're talking about overdose prevention, including how you can counter what is the dominant frame regarding this issue. The next slide, please. Okay, well, it's my pleasure now to introduce you to our speakers today. Kim Garcia is a media researcher at the Berkeley Media Studies Group. Kim joined, they also referred to BMSG, the Berkeley Media Studies Group, to support news and content analysis on social and health equity issues. They have 10 years of experience both in quantitative and qualitative methods, primarily in the field of public health, and with a particular focus on race, class, gender, and youth development. Kim has roots in the Philippines and Canada and brings this internationalist lens to her social justice work. She has a master's in public health from the University of California, Berkeley. With us also today is Ingrid Daphner-Krasnow. She's a strategic communication specialist with the Berkeley Media Studies Group. She provides media advocacy training and strategic consultation there. She kind of bridges this media advocacy expertise that she has with 15 years of prior experience in reproductive justice policy change, grassroots communication, and marketing strategy, as well as fund development and nonprofit management. Ingrid has a master's in public health from UCLA. So welcome, Kim. Welcome, Ingrid. We look forward to your talk.
Thank you so much, Mary, and to everyone on the call for joining us, and to Nopin for hosting us. We are really looking forward to our conversation today, and hope that you will get a lot out of it. Next slide, please. Just a little bit about BMSG before we jump into the slides. BMSG does a few different things. First and foremost, we do media research, which is one of the aspects we're going to be talking about today, one of our projects that my colleague Kim was lead on. So we look at how news issues are framed in the media, either in the moment or retrospectively, and look at how those issues are affecting public health, either in a positive or negative way, and what can be done to improve strategic communications to reach decision makers through the lens of media. We also train advocates, government officials, grassroots organizers, and folks delivering programs on the ground to understand how they can use their platforms as a place to influence decision makers and where the media fits into that strategic communications planning. And finally, we also work with journalists, because journalists are the ones who ultimately have the broadest platforms through our national, international media outlets. And we want to make sure that journalists are framing stories really from a systems perspective and less from that individual perspective, which is so common in journalism. And so we'll be talking with you all about that today, but it is something that we do work on with journalists directly so we can see that our news stories are really framing everything from that systems perspective. And I'd like to pass it to my colleague Kim to talk about the project. Next slide, please.
Thank you so much, Ingrid, and thank you for having me today. So just to kind of ground us in the background of this project, as many of you on this webinar know, overdose prevention saves lives. And while there are many successful and proven strategies for substance use treatment and prevention, they aren't really well known or widely available. And worse, they're characterized as controversial and plagued by misinformation. And while some have taken to social media to share life-saving information, advocates are continuously working to counter misinformation, stigma, and pushback from the public, service providers, law enforcement, and government leaders. So, to advance their initiatives, the National Overdose Prevention Network decided to partner with us at Berkeley Media Studies Group to develop a message guide to support advocates in their efforts to communicate effectively about substance use treatment and overdose prevention. So, we analyzed existing resources from around the US on communicating about overdose prevention, including toolkits, webinars, and reports. And we also interviewed a range of experts across California, including physicians, outreach workers, health educators, law enforcement, and coalition leaders to gain firsthand insights into the unique challenges and opportunities for effective communication about overdose prevention. So in this presentation, we'll share a few of our tips and tricks that will be featured in the final message guide, which we hope to publish in a few weeks, and we'll be sure to share that resource once it's available. Next slide, please. So today we're really going to be talking about our approach to communications at BMSG, which is really rooted in an overall strategy. So one of the main things we want you to take away from today is message is never first. So we'll share some of the steps to build out your overall strategy that will inform the rest of your communications. We'll also talk about some of our findings from our research that provided insights into how to talk about substance use and overdose prevention in your own community. And we'll share some specific challenges and opportunities, especially as you approach your messages and tactics for getting your messages out there. And finally, we'll share about the different frames or lenses that people may encounter while communicating about overdose prevention, and why those frames can create mental barriers, and how to craft your message strategy to put people on the path to better understanding why and how overdose prevention saves lives. Next slide, please. So, how do we get better at communicating about overdose prevention? Well, our answer is strategic communication. So, the way you communicate about an issue influences the way people understand what caused it and what must be done about it. So, before you can decide what to say, you must know what you want to change, who has the power to change it, and why it needs to be changed. And often, when people don't know what to say, it means they don't know what to do. So, having a clear overall strategy can increase the effectiveness of your communication to really advance your goals. So, I'll turn it now back to Ingrid, who will share more about our approach to strategic communications. Next slide, please.
Thank you, Kim. As you heard Mary introduce and Kim's spoken to already, the layers of strategy is the foundation of our work at BMSG. We really believe that these four levels, these four layers, are integral to any kind of communication strategy and communications planning. And overall strategy, that layer at the very top, is first and foremost. Like Kim said, You can't have a media strategy without an overall strategy. Many times people want to start thinking about their messaging before they really know what their strategic objectives are. And so we talk about overall strategy as that first step so that we can understand what is it that we are trying to achieve. So I'm going to spend the next couple of minutes really digging into what overall strategy means and how you can use the tool that Kim just put in the chat to uh, understand how to work through that overall strategy. Next slide, please. So your overall strategy consists of these essentially 5 basic components. So the first thing that you want to do when you're thinking about your overall strategy is you want to define the issue that you want to address. Sometimes we say, think about the problem you're trying to solve. Depending on how you are working on that issue, what is it that you want to see change in the community that you're serving? And what's the solution for which you're advocating? We know that most public health, all public health issues have multiple solutions that need to be employed to really see outcomes. What is one that you're working on around which you'll base your communication strategy? So we need to have a communication strategy for every different solution that you're putting forward. Next, who's the target with the power to make the change? So many times we think about community change as the community coming together to really see something shift in their environment. And while we, of course, want to see individual behavior change where possible, we really want to know who are the people in positions of power that can change the systems and structures that are influencing our populations. Obviously, from a public health perspective, we're looking at population level change. And in order to affect population level change, we really need to be talking with and working with the people in positions of power who are influencing our laws, our systems, and our structures. Fourth, we want to think about what are the actions that you want to take to influence your target? What are those things that you can do that are going to reach your target most effectively to influence them getting on board with the solution that you're seeking? And finally, who are the allies who can help you make your case? None of us wants to work alone in a silo. And so we want to make sure that we are partnering with other people in our communities and across the country who are working on similar issues to really have the most influence possible. So now we're going to go through each one of those components of overall strategy in a little bit more detail to give you some ideas of how you might approach this in your own work. Next slide, please. So when we think about defining the issue that you want to address, again, sometimes we think about this as a problem that you're trying to solve. We want to think about one aspect of a particular solution. And the reason that this is so important is as we get into our communications lens, we get into our framing and our messaging strategies that Kim's going to talk about a little later on, we really need to be focused on one specific call to action. And one of the ways that we think about this, that we remind our clients about this and ourselves is you can't be comprehensive and strategic at the same time. So if you're talking about all of the possible solutions to a particular problem, it's going to be very hard for that decision maker that you're targeting to know what you want them to do and what information is most important for them to know. We know that everyone on this call is an expert in their own right on the issues that they work on. We all have way more information than we could ever have time to relay to our particular target audiences. So what is the information that is most critical that's going to influence the decision that we want them to make? And finally, remember that your efforts are one among many to address an important issue. Obviously, like we said, public health has many different solutions for any given issue, and we need to be working together with our allies, with other people on the ground, with our decision makers to see those problems in our communities, those issues being resolved. Next slide, please. So when we think about the solution for which you'll advocate, we can look at this from a few different lenses. We know that many people on the call and in this work on overdose prevention are coming at this, what we would say at BMSG, walking through a number of different doors. So these are the doors that we've seen in our work with NOPN. And I believe that Kim's going to be putting a tool in the chat, yes, that can map the overall strategy with the different solutions that we're naming here. So the first being prevention of new addiction. So we want to, for example, educate students on substance use prevention and mental health. So we want to reduce use in the first place, right? The prevention of new addictions. We also want to be able to manage pain safely. We know that there are opioids in the population, in the general population, that are used for really important reasons. And so how can we continue to have those tools available to people without them becoming dangers? And without overprescribing by physicians, which then can lead to problematic behaviors with individuals. If we get to a point where addiction becomes a problem, we want to think about what are some of the treatments that we have available in the populations most affected by addiction. So what are those solutions that we can be looking for, in what populations are we serving, and which solutions are most appropriate for those particular populations? And then finally, and ultimately, we want to reduce preventable death at all costs. So how can we train people to use Narcan? How can we make Narcan more available so that it is available to people in those cases of emergency? Of course, we hope we'd never have to use it. But if there is an overdose incident in our community, we of course want to have the tools available to prevent a death. Great. So this is where we think about the target with the power to make the change. So this is really important because we need to know who's in a position of power to actually make the change that you want to see. And most of the time, we have to continue to get more and more specific with this analysis. So if we think about, oh, well, we need to go to the state legislature to make a change in our state. Okay. Well, who in the state legislature? Well, we need to go to a particular committee. Okay, well, now we know that committee, on public health and human services is really going to be the most influential over this particular decision. Well, on that particular committee, do you have certain votes that are already in favor of what you're trying to do and certain votes that you can move? Those movable votes, as we'll talk about in a moment, are the ones that you want to focus on primarily and use the folks who are already with you to support the case. So when you think about that target, you're really narrowing in on those people who you need to move from maybe not being as supportive as you'd like them to be to supporting the solution that you're trying to see. And then finally, what are the actions that you're going to take? Are you going to be making phone calls? Are you mobilizing constituents? Are you meeting with decision makers directly? Are you using the media to get a conversation going in the public dialogue that ultimately your decision makers will read and feel pressure to make a decision because they know that people are watching? So they're all different kinds of actions that you'll want to map out to understand how to get to your final solution. Next slide, please. And then finally, who are the allies that can help you make your case? We need to be meeting with people in their communities to understand how we can mobilize people who are supporting the work that we're doing and put pressure on our decision makers. Sometimes we need to meet with people in smaller groups and provide opportunities for them to ask questions to get a better understanding of the solutions that you're trying to put forward. Or make an opportunity for different perspectives to come to the table so that we can be listening to each other and remind each other of our shared values, that we ultimately really want the same thing, and that if we can get on board with understanding a shared solution, we can find that shared outcome that we really want. Next slide, please. So we're going to move down in the layers of strategy now to message strategy. And Kim is going to lead us through a conversation around framing and reframing. And again, that link that was put in the chat earlier with our layers of strategy can help you follow along where message strategy fits into all of these layers. But also that will be available online afterwards if you just want to take a moment and just think about the message strategy concepts that Kim is going to walk us through. Next slide, please. And Kim, take it away.
Awesome. Thank you, Ingrid. So just to kind of better understand what we're talking about when we talk about frames, we just wanted to share that, all people come to new information about what they see or hear already in our minds about the way the world works. And these existing notions, they form mental structures or frames that allow us to integrate new information into our brains into a coherent way. And it can be really subconscious. Without even knowing it, we can use frames to categorize information, identify patterns, and derive meaning from them. And frames matter because they can foster certain understandings and hinder others. And often all it takes is a single word or image to activate an entire frame that then determines the deeper meaning of that word or image. And these frames can trigger emotions, associations, values, judgments, and they create tracks for a train of thought. And once on that track, it's really hard to get off. And so, people can hold multiple, even contradictory frames in their mind. And the one that gets triggered and repeated more often is the one that has a better chance of influencing people's interpretation of the message. So, one of the most dominant frames that we encountered in our research was drug use is wrong or dirty. And this is a really harmful frame that reinforces stigma around substance use. Dirty or clean is associated with filth, and it's not really a medical condition. It can invoke bias and shame. So we suggest as a potential reframe is to move away from the negative consequences or saying that drug use is wrong to framing substance use as a health condition. It can help put people on the path of considering that substance use is treatable and preventable with healthcare access to improve people's health and well-being. Next slide, please. Another common frame that we found in our research is drug users are addicts or junkies. And these terms can imply that an individual causes their own illness and can lead to less sympathetic responses. So, for example, incarceration instead of treatment. And we know that people are not their condition, and addiction is not a choice or an identity. So, to reframe, we recommend, using person first language. For example, talk about a person with substance use disorder or people with substance use disorder. And we want to normalize the fact that anybody can suffer from substance use disorder or suffer from overdose. So we heard from one expert, you know, many of those addicted to opioids are our neighbors, our loved ones, and people who are otherwise high functioning. And overdoses can happen to anyone with any substance, whether it's prescriptions and pain management to substance use or opioid use. So, um, we heard time and time again that we really need to move away from these really stigmatizing terms and use person first language. Next slide, please. Um, Another common frame that we heard is I don't use drugs or there aren't any drugs in my community or in my school, so it's not my problem. Some people may think that these issues are problems somewhere else, but this blind approach really ignores the reality of substance use disorder and the opioid crisis. So potential reframe is to say that, overdoses can happen to anyone, and 1 in 7 Americans in their lifetime will have a substance use disorder. One person that we spoke to said, do you have friends? Do you have children? Do you have babysitters or grandparents? Let's be prepared rather than not because it's a life and death situation and we have the tools to help this. It could be you or you have an uncle visiting and drops a pill. So, just really normalizing that this can happen to anyone. It's not a far and away problem, but actually something that's in our communities right now. Next slide, please. Another common frame we hear is harm reduction enables drug use. Some people may think that it's like makes kids feel like superheroes. But in actuality, this really reinforces stigma and misinformation about overdose prevention. So we want to reframe this. One of our experts really shared harm reduction is healthcare, just like doctors reduce harm from disease or illness. And there are decades of evidence supporting medication and treatment for substance use disorder. So kind of linked to that first frame we talked about, We want to share that overdose prevention is possible, is treatable, and medications are treatment tools for other diseases, and substance use disorders shouldn't be treated any differently.
So thanks to Kim for taking us through all of the reframing. And one of the ways that we talk about reframing is thinking about it in these three different levels, which is developed by cognitive linguist George Lakoff out of UC Berkeley. And you'll see in the pyramid diagram that the idea here is that level one is the foundation, literally the foundation of our messaging. It's the widest part, it's the base of our pyramid. And this is where we want to infuse values. So the values part of our message, which we'll go into in a moment, is the part of our message that is going to be the most influential over the way people make decisions. So we want to make sure that we're understanding the values that we hold that are going to influence our target audience and the values of our target audience. Sometimes those values are going to be the same, sometimes they're going to be different, but what matters most is that we understand those values really clearly, because people are not going to respond as well to data as much as we in public health love data. People make decisions primarily based on values. The second level, level two, is the topic area, like housing or jobs or healthcare. This is the category in which you can nest your messaging. So a lot of times we think about overdose prevention as healthcare, which is very important. And we also know that overdose influences many other factors of our lives. Maybe it's connected to childcare. Maybe it's connected to housing. Maybe it's connected to hunger. And so depending on the industry in which you're working, the field in which you're working, or the target's field, um, will impact how you categorize the solution that you're proposing. You may be able to propose a solution that is seemingly outside the field that you work in, because the person in a position of power to create the change that you're seeking really cares about that particular issue. So think creatively on how you nest your issue in that level two category. And then level three, these are the details of the policy approach. So again, for the public health folks on the call, these are the steps that you'll see. These are the tactics that you would take in a logic model, for example. And many times we want to talk all about these steps. We want to get into the details of a particular solution. Unfortunately, the details often get lost when we're trying to influence decision makers' behavior. Really, again, when we're thinking about messaging, we want to just briefly talk about the tactics that we might take, but focus primarily on that foundational level of values, because that is really what's going to influence the way that people make decisions. Next slide, please. And so this is just a reminder to articulate your values. Many of the solutions, in fact, that came up in the word cloud in the poll question that we asked in two polls ago, those were also values. A lot of times we see our values reflected in our solutions. The language that we use is actually values-infused language that incorporates itself into our solutions. And so just recognizing that and relaying those values to our target audiences so they know why we're making the decisions that we're making. They know why we're so focused on the particular solutions that we're seeking. So I'm going to pass it back to Kim now to talk a little bit more about the details of what goes into an effective message.
Great. Thank you, Ingrid. All right, next slide, please. So here we have some components of a message that we like to use. And it's really just to help, create these little buckets, and consider this your recipe. And they don't have to be in this particular order. But certainly these are the three things that we really want you to include in your message. So the problem or the issue, what is your perspective on what has gone wrong? And some audiences may ask for evidence or science to better understand the problem. You can provide some data points, but maybe not start there. Really, you may want to start with your values. Why does it matter? As Ingrid was talking about, this is what really speaks to the hearts of the people. And finally, what is the solution? Who should take action, and by when? And why is this the right solution? So you may be able to show success with examples or stories or data. So In these next few slides, I'm going to share some examples of messages that we crafted based on some of the interviews and the research that we did, just to kind of walk you through some potential scenarios and some potential messages that we wanted to share. And so, one of the problems we heard is that there's a lot of stigma about harm reduction approaches like Narcan. And one solution we heard from folks that we spoke to is for a school policy to have Narcan available on campuses. And so the target audience here would be school administrators or school district representatives. And the example messenger here is a teacher. So I'll read this message out loud and then break it down by these different components. So, I became a teacher because I believe that every child deserves to thrive. It's hard to think about kids in our community using substances, but we can't let stigma and shame keep us from being prepared for dealing with an overdose. When students start experimenting with harmful substances, our schools and teachers need to know how to respond properly to an overdose. This is a life or death situation, and if we have Narcan available in our schools, like what we're seeing with other schools in California, we could be better prepared in the future. That's why I am calling on the school district to adopt a policy to have Narcan available in schools so that no student or teacher has to live through the trauma of having or seeing an overdose. This can show our students that we care about the well being of our future generations. So, in gray, highlighted in gray, are values language that we wanted to lift up. Every child deserves to thrive, preparedness, um, maybe uh, well-being and care for future generations. The text highlighted in black illustrates some of the problem, and you can use your own stories and in your own experiences here to describe what you see as the problem or the issue you're trying to address. And then in yellow is the solution, which is to have Narcan available in schools, and to have this adopted as a policy, so that any teacher can be prepared. Um, so this is just one example. And on the next slide, we'll go through another example where we heard about the issue of funding cuts to harm reduction programs, which we know can increase the risk of infections, increase the number of emergency room visits, and we really wanted to hone in on values like safety and fairness and health, and um, convey the solution to reinstate funding to harm reduction programs. So the target audience here would be government officials, and a potential messenger would be doctors. So as a doctor in our community, I am proud to take care of the health of our community. However, the reality is 1 in 7 people are living with substance use disorder, and when we're not doing what we can to keep them safe, we're not living up to our duties and values. Our ability to keep our communities healthy and well has been undermined by funding cuts to harm reduction programs that serve thousands of people a year. I'm scared to see what the future holds for our community by not having those resources. That's why I'm calling on our government leaders to reinstate funding to harm reduction programs so that our community can access life-saving treatment. These programs can save our community money in the long term. By restoring funding, we keep our communities safer and healthier. So in gray, we wanted to bring out values like health, wellness, safety, um, and in black, we're bringing in a little bit of data. We're also bringing in a little bit of storytelling. What this person actually, it's a direct quote from one of the people that we spoke with. Was actually scared to see what the future holds for our community by not having harm reduction resources. And the solution in yellow is to call on government leaders to reinstate funding to harm reduction programs. So um, these are just some examples that we wanted to lift up here. Next slide, please. Another interview that we are drawing from was with law enforcement. So in this example, we heard that law enforcement may not know a lot about substance use or harm reduction, and there may be a culture of stigma around this. And so one of the people that we spoke with is a former law enforcement officer and spoke to this possible solution of educating and training law enforcement on overdose prevention strategies. So the audience here would be law enforcement, and the messenger would be former law enforcement. So, as law enforcement officers, our duty is to serve and protect our communities. I used to think that overdoses weren't my problem. There's a lot of information prevalent in our field, but I've realized that substance use is a health condition that requires care. So, we need to have the courage to admit that the issue is there and identify solutions for a better path forward. If we don't try to save a life, there is no chance of recovery. That's why I believe law enforcement should be educated and trained on overdose prevention strategies that can keep our community safe. Narcan is a tool for you to use just like all other tools you have on your tool belt that could save someone's life. Law enforcement has not only an opportunity, but a responsibility to be a part of the solution for the safety and security of our communities. So we really drew on the values of um, responsibility our law enforcement officer shared with us. So the solution to educate and train law enforcement on overdose prevention strategies, including Narcan. And again, just rounding it out with those values again of um, responsibility for the solution and keeping communities safe. And I'll turn it back over to Ingrid.
Thanks, Kim, for all of your explanation and the amazing work on developing those messages and understanding what the messages are that are so effective at the national level and where we still have work to do. And again, the toolkit that Kim has mentioned is forthcoming, so there'll be some great resources in that. One of the things that we know is most important when we think about our message development is our messenger. It's a big part of our message strategy. Who is going to deliver your message oftentimes has the most influence over how that message is received. I think we all probably have those folks in our lives that when we hear something from them, we may give it a little bit more thought, a little bit more consideration because we trust the source so much. So when we think about messengers for overdose prevention work, some of the most powerful people are people with lived experience who can talk about how their experiences have had an impact on their lives, on their families, on their their careers, on everything in their lives. And how can we learn from people with lived experience to inform our solutions and to influence the decision makers that we're trying to influence? We also want to think about what we would think of as insider versus outsider messenger. So sometimes in a particular community, it can be important that a message comes from someone within that community. Or maybe it's within a government body and the message needs to come from another colleague from within that government body. Sometimes having an outsider message, maybe someone who's considered an expert in the field, maybe it's a medical professional, maybe it's law enforcement, can have either a positive or a negative influence over our decision. So we just need to give consideration to whether or not a messenger is considered a part of the community that it's serving, a part of the body that it's trying to influence, or someone from the outside. And how is that relationship going to affect the way that message is received? And then finally, what's the role of a neutral messenger? Oftentimes, we do live in very divisive communities. We live in divisive environments where these decisions are very hard to make. There may not feel like there's one right answer. And so if there's a neutral messenger, someone who really is trying to see things from both sides of a both perspectives of an issue, or the many perspectives of an issue, and can really come at this from a neutral place, sometimes that's the person who's going to be the most well received. So it's thinking about who that messenger is for a given message that it's going to be most important. Next slide, please. Some additional tips that we can offer in terms of your message delivery. is storytelling. So when we use storytelling, we're able to reduce stigma because we really put a personal spin on a particular issue, a particular problem that's been seen in the community, and a solution that may be effective. So one of the ways that we do that is we expose people to our personal stories and thereby build empathy and understanding. When you see that someone else has gone through something, someone who you might relate to, someone in your community who maybe you didn't know was going through such a struggle, that will help build empathy and understanding for a particular issue. We also, as Kim has talked about multiple times in this webinar, we want to shift away from blame, shame, or victimization. So personal stories are important, and we want to nest those on one when we talk about one individual person's experience, we want to nest those within the larger systems or structures that we have in our society that are influencing our personal outcomes. So in many of our webinars, we talk about the difference between a portrait and a landscape frame. Portrait frame being that only really shows how an individual is being impacted, versus the landscape, which really shows all of the many factors in a person's environment, in the systems and structures that have an influence over that one individual's outcomes. And we want to make sure that when we are painting a picture, when we're telling our personal stories, we're nesting those personal stories within that landscape frame so that we understand, yes, this one person had a positive outcome, and it was because of a number of different systems and structural supports that that person had. They weren't able to do this all by themselves. Next slide, please. We also want to use metaphors as a way to bring people along on our messaging. So metaphors and analogies often make it easier for people to understand abstract and complex issues. And sometimes it's useful when we are getting pushback on a particular issue to use metaphor to help people understand why we're advocating for a particular solution. So one example is, as someone has said in the participant chat, oftentimes people push back on harm reduction because they think we're enabling people to use harmful substances. And one thing that we can do is say, we want to use our harm reduction medication to reduce the possibility of a fatal outcome, just like we would use a fire extinguisher if there was a fire, CPR if someone was choking, or a seatbelt to prevent death in an automobile accident. These are all tools that we hope we'll never have to use, but we want to have available to us just in case of emergency. So by using metaphors that people can already relate to, I don't think anyone would argue with having a fire extinguisher in a home or a restaurant, or administering CPR to someone who is choking. In the same way, we can use that metaphor to talk about harm reduction medication and other harm reduction tactics to prevent overdose death. Next slide, please. There's also a way to respond to misinformation. We know that misinformation is really problematic in the harm reduction community and in preventing overdose. And one of the things that we recommend is reducing what we call elephant triggers. Again, this is a concept by our colleague George Lakoff, one more time, from UC Berkeley, who talks about the idea that it's the old joke: if you ask someone, think of any animal, but just don't think of an elephant, the first animal that someone is going to think of is an elephant. As soon as you suggest it, it's really hard for people not to think of whatever was suggested. And so what happens in framing is the exact same thing. Once we start to talk about something being negative, well, this is not about, or well, we don't want to enable overdose, or it's not true that harm reduction tactics are enabling. Once we start down the road of feeling perhaps defensive or defending a particular position, then the people on the receiving end of that message, similar with the elephant concept, it's all they can think about. And so what we want to do is flip that frame to the positive. So we want to talk to people what this is about. This is about saving lives. This is about preventing a preventable death. We have tools that can prevent an overdose. Let's use the tools that we have available. What do we want to achieve? We want to create healthy communities. We want to create communities where everyone has the resources that they need. And what do we know is true? Rather than debating whether X fact is true or Y fact is true, what do we know is true? I know that when I used this particular tool, when I used this harm reduction medication to help this person who was in the middle of an overdose, that person lived. I know that when these medications are available in more accessible ways, that people have access to them when they really need them. So we talk about what we know is true rather than defending the things that we don't want people to be thinking about. And we call these elephant triggers with that same idea. We want to avoid giving people the information that we don't want them to be thinking about and making sure that they have the information that we do want them to be thinking about. And to wrap up our session with you all today, before we get to the Q&A, Kim is going to lead us through the most important final strategy, which is access strategy. How are we going to reach those people on the platforms that we care so much about to get them to carry our messages forward? So next slide, please, and I'll pass it to Kim.
Thank you, Ingrid. Yes, this is the final stretch of not only this presentation, but also your strategic communications is your access strategy. So we recognize that a lot of folks working in this field are talking to everyone, everywhere, all at once. And so there's a lot of different audiences. There's a lot of different ways to reach your audience. So we really want to identify, what are the best methods to communicate with your target audience? And you can decide if engaging with the media would advance your goals. And then you can compile the different tactics you'll use. So next slide, please. So there are many different ways to reach your audience. I found in our research that you may want to use social media to help you reach younger audiences. We also learned that, social media campaigns allow folks for easier changes in direction compared to larger scale campaigns. So you can quickly change or adapt your language based on your audience. We've also heard, printed materials may be more appropriate for adults and seniors. So, consider more of those analog approaches if your target audience is not really online on social media. Um, and if you are interested in using the media to advance your policy goals, traditional and print online news publications may be a way to reach policymakers. So if you feel that news coverage will help advance your policy goals and reach those target decision makers, you can consider how you'll pitch your stories to a journalist. So overdose prevention is important to advancing the health of communities, but journalists tell stories, not issues, and they can't possibly cover every issue. So to get in the news, you have to offer a story that is interesting as well as important. And there are also, we also heard from other folks that maybe audiobooks or podcasts might be helpful for people with different literacy levels who prefer listening rather than reading. Perhaps for Spanish-speaking communities, they may be more inclined to meet in person versus on Zoom. So getting back to what Ingrid was talking about earlier during the overall strategy portion of our presentation, really thinking about who is your audience, meeting your audience where they are, considering the places where people go, where people get their basic needs met, whether it's food or gas or going to the hospital. These are all different opportunities depending on what your target audience is. So your access strategy is really your final mile, and there are many different ways to get your message out there. But again, this all connects back to your overall strategy. What is the solution you're trying to advance, and who is your target who can help advance that solution? So I believe that is all for us. Next slide, please. Of course, this is just a little bit of what we're going to be sharing in our final message guide. So if you'd like to stay in touch with us directly, here is our contact information.
Yes, thank you so much, Kim and Ingrid, for that excellent presentation. And the way you set this up, it really has this excellent almost formula for going through and really being effective of how we're communicating. And with the multiple issues, the multiple audiences, the multiple policy changes, everything that is involved in overdose prevention, really helpful information on how to break this down and be effective with communication. Really appreciate that. And we are going to have time now for questions. I'd invite everybody to put any questions you have in the Q&A. I also want to bring everybody's attention to the chat. There have been some wonderful resources that have been listed there. Among other things, I want you also to know that Ingrid and Kim did another excellent webinar just a couple of weeks ago, and that was specific to lessons in framing overdose prevention with considerations for rural populations, rural communities. And really invite you to take a look at that. That can be found on the NOPN event page. So do take a look at that. Also, Kim and Ingrid have posted several workshops from the Berkeley Media Studies Group. One is on how to develop your overall strategy, and the other is on message development. So great resources that are there for you also. So I did want to start off. We have a couple of questions that have come in the Q&A. Again, we invite you to add additional questions. But one of those was brought by, let's see, we have several here. I wanted to see with the, I'd mentioned the prior webinar that was done by Ingrid and Kim about considerations for rural communities. I was wondering if you could briefly discuss what are some of those main considerations for those who are participating in our webinar today who are from rural communities. What should they be thinking about specific to their rural status?
Yeah, great question. I'm happy to field this one, Ingrid, if that works for you. Okay, great. Yeah, so we talked with some experts who work in rural communities because we really wanted to get a better sense of what are the different challenges there. And of course, you know, there's distance and scarcity and uncertainty. And for people with substance use, it takes a lot of time and money and energy to stay well, more than in urban areas. And sometimes that lack of services can make substance use more risky. So we really recognize that these may be different challenges, but we also wanted to, first of all, highlight that rural communities are not a monolith and we can't make assumptions about people living in rural communities. So um, and in fact, they may be even more aware of the issue and be prepared to talk about solutions than not. So, um, for rural communities, I guess if you are interested in engaging with the media, just recognize that there may be smaller media markets and local newspapers may serve multiple towns or may not have the staffing to write about these issues. On the other hand, you may be able to engage directly with local reporters and use those as an opportunity. You know, whenever you see coverage about substance use and overdose in those local newspapers, you can use those as an opportunity to write a letter to the editor or tell people about your work and submit op-eds about upcoming events or activities. We also learned that rural communities may use alternative forms of media like social media because of the stigma as a major barrier for people in rural communities where people are, you know, in each other's business a little bit more. Um, Having closed discussion groups like those on Facebook may provide more comfort, privacy, and safety. And so you may find that your target audience that you're trying to reach may be within those closed discussion groups on Facebook. Um, and we also just wanted to highlight some of the great work happening in NOPN. I know that a lot of the people here probably on this call work on building partnerships and want to work as on a regional level. So just really recognizing that your patients cross county lines, your providers cross county lines, and so communication should cross county lines and really pulling together different partners to expand the reach of your message. Anything else,
Thank you very
Ingrid, that you want to share?
No, I think that was an excellent synopsis. And again, the webinar is available online on the NOVIN website. If you haven't seen it, I would encourage you to take a look.
Wonderful. And also, there are some prior webinars too that I was just thinking of that about working in more conservative environments that we've posted over the last couple of years with both the California Overdose Prevention Network and the National Overdose Prevention Network. So again, take a look at the NOPM website. But thank you so much. I'd really strongly recommend you do check out the prior webinar that Kim and Ingrid did. It was great. We've got several questions that have come in for you. One is, how do we reframe in communities who think that drugs and crime are linked, so think that it's not important to put resources into overdose prevention?
I'm happy to answer this one again, Ingrid, unless you'd like to.
No,
Yeah, we definitely have heard this is a major barrier or challenge. And I think, when Ingrid was talking about storytelling and metaphors, these are ways to illustrate to your community that substance use isn't just a criminal activity, and overdoses don't just happen to criminals. This can be anyone. And so by using storytelling to really um, humanize and normalize the experience, can hopefully shift the blame away from crime and criminals to making it more of a public health issue. And also, I think the use of metaphors can be really helpful in that way too, as Ingrid shared, that these are not just resources to enable drug use, but they are life-saving, and just like CPR or stop signs. So I don't know, Ingrid, if you have anything you want to add there.
Um, I would say, just when we think about the framing and those pitfalls of our messengers, talk about the people who are impacted as the humans that they are, really framing their lived experience as parents, as professionals in the community, as stakeholders in our political system. Everyone who has been influenced or impacted by substance use disorder wears many hats, like all of us does. So how can we talk about the characteristics of the individuals who are most impacted in the ways that will help other people relate to them and understand that they, each of us is a really complex human, and we need to be focusing on that complexity rather than the stigma that's associated with substance use disorder.
excellent. Yes, definitely very good ideas. I'm always struck by the fact that we now in this country, 42% of the population knows somebody who died of an overdose. That's remarkable. And we know those human beings. It's yeah, great suggestions. Thank you. Well, we have one person wants to know, do you offer, they found this so helpful, do you offer consulting or other support directly to organizations on how to improve messaging and media strategies?
We do, yes. You can find all the information at bmsg.org. And if you give me just a moment, I'll just pull up our training and technical assistance link and put it in the chat. But we'd love for you to reach out to us. We work with organizations as small as one person all the way up to, national level organizations. So please be in touch. We'd be happy to talk more.
Great, thank you. Also, there's been a request if it's possible to share some of the slides with a class, particularly that one where you're talking about how to message with the values, the strategy, and I'm forgetting the third one, but but is that possible for these to be shared with other folks more widely? And obviously putting your name there and as part of that. Okay.
Yes, we'd be happy.
I think that's a yes. Okay, great.
Happy for them to be shared. All the
yeah.
PDFs that we shared in the links should have all the information that you need on those. And if you're not finding something you're looking for, feel free to reach out.
Thank you, Ingrid. The same person was talking about working in their community, and an individual who has a lot of background experience with substance use disorder and overdose activities, does not support naloxone training due to the belief that it supported opioid use. This person used the harm reduction approach and expressed understanding their viewpoint. Do you have some suggestions on navigating with individuals who have this type of perspective? How can you most effectively communicate with individuals who hold these beliefs?
I'm happy to start, but I know Ingrid will have lots of great tips as well. But it sounds like, this is maybe someone who um, does a lot of work in substance use and overdose prevention, but may hold some beliefs around um, naloxone. And I think one way to counter that is with the evidence that um, harm reduction saves lives. Ultimately, that is the bottom line, I think, here. Um, Also, that that these are like really tricky issues, and I think NOPN has some great resources on I think it's persuasive narratives. So really, some of these concepts may be really difficult for people to wrap their heads around, and so by maybe employing like strategies like persuasive narratives or kind of motivational interviewing to really get a better understanding of what may be coming up for this person that you're speaking with. What are some of the barriers or what are maybe some of the misinformation that they might be encountering that enables this belief? So, I think just really taking that smaller group or one-on-one approach to better understand where this person is coming from. And then again, really go back to your message and the values that you're trying to convey, which is um, harm reduction saves lives. It improves the safety and well-being of our communities. Um, and again, it's not going to be a one-time maybe conversation. So we heard this from a lot of experts that sometimes you have to have these conversations over and over again, and that it does require a lot of patience. So appreciate all the work that you're doing to try and approach this person and recognize their viewpoints. It is a challenge, and it may be something that you have to revisit. Ingrid, I don't know if you have anything else you'd like to add there.
No, Kim, you really summarized it beautifully. I was going to emphasize the idea that communications just takes time and repetition. When we think about the progress in public health that we've made on the tobacco control movement, we talk about it now as tobacco control. It used to be called smoking. And when we think about all of the work and the decades that went into reframing that issue and really shifting it from that individual frame, smoking is very much an individual frame, to tobacco control, which is really a systems and structure frame. It took a lot of time and a lot of people and a lot of conversations. So just being persistent with those conversations, continuing to go back to the table and sharing your perspectives, and ideally the folks who you need to move will move, even if it happens slowly.
Thank you. Another aspect that I really like that you always stress is connecting it with values. If there are shared values, I just really appreciate all your work on how we can go about this and in the multiple circumstances that we're holding these conversations and communicating with our community. Thank you. Another question that came in: how have you seen this work among the Hispanic community? Harm reduction, and in terms of harm reduction, and also working with the police and bridging between those two issues. This person's from California. There are a lot of misunderstandings and challenges. What do you suggest in terms of communication to improve these situations?
That is a great question. And it brings up a lot of different issues at the same time, working with Hispanic communities, harm reduction, and working with police. I can maybe speak a little bit to working among Hispanic communities based on some of the research and interviews that we did. And we found that some of the experts that we spoke with really talked about meeting communities where they are. Maybe it's a community center, maybe at an event where they're getting, community resources and offering Spanish language resources. So, and having a Q&A after. This one person we spoke with spoke to an event where, set up a video describing, what is substance use, just a very like educational video that they shared in both English and Spanish, and then provided Q&A after. So, they had representatives, I think it was doctors and other community health workers who could answer those questions. And they got tons of people lining up, apparently, just trying to better understand in their own community how they can, um, reduce the harm from substance use. In terms of the Hispanic community and working with police and bridging those two communities, I'm sorry I don't have any specific resources on that. I don't know if anyone else on the call has something to share around that, but certainly would love to learn more. And I'm sure there are lots of great resources in this community. So.
There's a couple of suggestions: constant community outreach, meet them where they are, which is, no matter who you're dealing with, is always really important. And then feel free we welcome any suggestions or anything you want to put in the Q&A. Thank you. I love the way that you talked about, how you should deal with misinformation. And I love how you say stop, which is really, stopping that immediate reaction and say, well, this isn't true. What are they thinking? Stop and reframe it, which is just an excellent idea. How about when you get pushback, a little bit different? If you get pushback about the message, how do you deal with that?
Sure. I can speak to this in broad terms, and then Kim, if you have insights from the research, we'd love to hear that. But one of the things that we talk about at BMSG and when we do our work with spokespeople is this concept of pivot phrases. And pivot phrases are those phrases that help you, as the name suggests, pivot from one idea to another. It's this idea of essentially sidestepping a question that you don't feel like is valuable of your time to answer that question, and giving people the information that you want them to receive. So when you get pushback on a particular issue, one thing that you could say is, a lot of people think that, but what we know to be true in our community is X, Y, or Z. Or many people ask us that question. In fact, what really happens is, or sometimes people will bring up an issue that may actually be relevant to the larger issues that you're working on, but not the topic that you're discussing at the time. So you could politely say, that's a really important issue. I'd be happy to talk with you about that later. But what we're here to talk about today is housing, or what we're here to talk about today is nutrition. And so you acknowledge it in a polite way, and you move on to the topic that you really want to address.
Mm-hmm.
And this is about owning the floor. This is about really taking ownership of the time that you have and knowing, okay, if I only have a few seconds of this person's time or a minute or two, I want to make sure that I get to the messages that I want them to hear. Kim, did you have anything to add from the research?
I think Nopen actually and Copen have some great resources. I'm gonna put them in the chat. One is a YouTube video on managing pushback. There's also this worksheet on managing pushback from the California Opioid Safety Network. So definitely leaning into the existing resources here, in addition to what Ingrid just shared.
Thank you. Yeah, and thank you for bringing up that there is this library that has so many resources. We really invite you to use everything, share widely. That's what it's there for. Wonderful, and I love this idea of pivot phrases, because it can both, with pushback, and then particularly with the issues about messaging, when we get pushback or when we get misinformation, it can derail your message. So being prepared for that is so important, and appreciate that very much. Great. Let's see if we have some additional questions from the group. Also, I wanted to know, overall, when we're looking at communication, how do we incorporate equity considerations into this? we are trying to do this throughout all of our work in overdose prevention. Are there particular issues regarding equity that you think either tools to make sure that we're incorporating this or considerations as we're developing communication strategies?
Again, Kim may have insights from the research, but one of the things that we talk about when we talk about ensuring that equity is front and center of all of our messaging is that portrait landscape frame. So understanding that when we think about the systems and structures that affect our health outcomes, we know that many of them are based in policies that were founded in racist positions, that were founded in positions that affect people of color, marginalized communities far more than white communities. And we need to make sure that people are seeing those problems in the systems and structures to understand that individuals only have so much control over their health outcomes. And one of the things that we talk about is sometimes the language of equity is the actual words are not as effective as painting the picture of what people are experiencing. And so we want to make sure that we are showing how people are affected and how these inequities are manifesting in communities across the country and how the disproportionate impacts that are affecting our communities and the roots of those problems. So painting that picture really in that landscape frame is one of the primary ways to address issues of inequity in our framing and messaging. Kim, anything specific that you wanted to mention from your work?
Yeah, thank you, Ingrid. I think that is a really important point, just really expanding that frame to really look at the landscape and understand what are the systemic and historical harms that are happening among Black communities, Indigenous communities, people of color, non-English speaking communities. And again, no community of color is a monolith. So, really, of course, honing in on what is your community really saying, who are the people you're talking to. But I think, we want to work on improving the relationship that Black, Indigenous, people of color have with healthcare providers in a system and a medical system that's been historically and continues to be harmful, and increase access to overdose prevention strategies for Black, Indigenous, and communities of color. So I'm going to drop a link in the chat from the Urban Institute, who has some recommendations for programs and funders who serve people who use substances, particularly communities of color. So I'll add that resource there, and we'll have a little bit more on this in the full message guide as well.
Thank you. And the additional suggestion that came in is really using culturally appropriate, rather culturally, excuse me, it just disappeared from me as I hold on 1 second. Okay, go back. My apologies, it just absolutely disappeared from my link here. Oh, here we go. Using culturally relevant artwork, creating artwork as with local communities, really going to those communities that you're working with, creating them as they understand history and generational trauma that's associated with lack of equitable services because systems were built to exclude them. So they've been incorporating in the development of messages and that perspective. Great suggestion. Excellent. And there was another question about resources for primary prevention of opioid use. I would suggest you look at the NOPN library. They have a lot of information there, and I think that will be very helpful. Unfortunately, we're at the end of our time. I would really appreciate the incredible presentation that you did today, Ingrid and Kim. We really appreciate all the suggestions, the multiple resources you've provided. Thank you so much. And then encourage everybody to look at that prior one that is specific with rural considerations. Thank you all so much. Could I have the next slide? So thank you all for joining us. First and foremost, thank you for all the work, the incredibly important work that you are doing for overdose prevention. And thank you so much for joining us today. And we certainly hope that you will join us for future webinars for the National Overdose Prevention Network and Dialogue for Health. Thank you, everyone. And we love the emojis. Thanks so much. Bye-bye.